Hello, welcome to the online tutorial classes for the Vidya Bhavan High Secondary School, and today this class is for the class 12 nutrition, and the chapter what I discussed today is the common deficiency diseases in India. So as the very first, the deficiency diseases are mainly of two types. Okay, the deficiency diseases are mainly of two types. The first one is due to the macronutrients and second one is for the micronutrients. So what are the macronutrients of our diet? The carbohydrate, protein and fat are the macronutrients of the diet, and the vitamins and minerals are the micronutrients of the diet. So as the name suggests, the macronutrients deficiency diseases are mainly due to the lacking in diet of carbohydrate, protein and fat, and the micronutrients are mainly the lacking of the vitamins and minerals. And today I will discuss mainly for this macronutrient. Okay, so very first, the deficiency of macronutrients are basically for 5 types. So what are they? Mainly kwashiorkor, second marasmus, the third one is marasmic kwashiorkor, marasmic kwashiorkor. The fourth is nutritional dwarfing, and the fifth is underweight. Actually, we know these all are protein energy malnutrition. These all are the types of PEM. So the very first we will talk about this kwashiorkor. The kwashiorkor is called the disease of the displaced child. Mainly it is occurs due to the deficiency of the protein. The babies who are displaced from his or her mother, they can be the sufferer of the kwashiorkor. So what are the main signs and symptoms of this kwashiorkor? Sign or the symptoms. One is edema. Edema is, what is edema? Edema is mainly the fluid retention in the whole body. It mainly seen in the legs and the hands, and also in the face area, but it is the fluid retention. The second clinical sign is poor growth. They didn't grow properly according to their age. Their big retarded growth can be seen in this condition. The third is mental changes. They are not that much mentally updated as like the other children because of this kwashiorkor. Okay, and the other signs, and also they have some other symptoms or other signs. They are like they have the moon-like face. They have the skin changes. They have this toad-like skin. They have flaky skin, and also the water and electrolyte imbalance, etc. Okay, so the kwashiorkor is done. Now we are coming to this marasmus. Marasmus is mainly for the energy and protein both deficiency. It's mainly for the protein, and it is protein and energy. And this is mainly seen on the ages of 1 to 3, and this is for the 2 years, like, okay, below the ages of 2 years actually. So what are the main differences between them. There are no water retention in this marasmus, but the water retention can be seen in this kwashiorkor. And also they have also the retarded growth and like the monkey faces. And also they have the loose motion problems and the skin problems and the many more related problems. Okay, and now we are coming to the marasmic kwashiorkor, where the marasmus and the kwashiorkor came together. They have the protein imbalance, they also or protein deficiency, they also have the calorie deficiency. So when they came together, they became a big problem, which is the marasmic kwashiorkor. Okay, in this the extreme muscle wasting can be seen, like this. They can't pull anything, they can't write, they can't do anything. And also the edema, the absolute weakness is a very common thing which can be seen in these conditions. Okay, so the next we will be talking about the causes of PM. The main causes of PM are, firstly, the low intake of food or improper intake of food, as they didn't consume the carbohydrates and the proper energy, and also the proteins. That's why the marasmus kwashiorkor and the marasmic kwashiorkor can be occurred. And the second is poor socio-economic condition. These problems mainly seen in those who are socio-economically not that much strong. They are below the poverty level. Okay, and 3 is maternal malnutrition. As we all know, if the mother is not healthy, they can't give birth a good healthy child. So if the mother have any deficiency in their diet, so the children what she give birth is not that much nourished. The fourth is inadequate breast milk. As we all know, the breast milk is the best thing for a child. But if the mother didn't feed her child or can't be able to feed her child, if the milk isn't produced in her body, then how can she, right? So inadequate breast milk production as well as inadequate breast milk consumption can be the main cause of the kwashiorkor and marasmus, and also the marasmic kwashiorkor. The fifth point is delayed complementary feeding. After the 6 months or 7 months, every child used to with these other foods, not only the breast milk, and after and the other foods like the rice, like the fish, and etc. And those children are not going to have this complementary foods, or they have a delayed in the complementary food due to the economical status and everything. They are the sufferer of this kwashiorkor and marasmus. In the sixth point, the improper absorption. If the child have any physiological problem, then the improper absorption of the food can be seen. Then that's why the kwashiorkor or marasmus can be happen. 7 is high parity. When a mother gives birth, the number of child are very and in a very short time period, she given birth give birth a very big number of child, like after years or after every 2 years she giving birth a child, then the mother's condition, mother health condition is very low, and that's why this high parity can be the cause of this PEM. The 8th point is family size. If the child have a big family, then the food portion what he or she should consume, it will be distributed among many of them. If the family is a lower poverty level, then it is a big deal. Then it will be a big deal. And the 9th point is infection. If the child is not that much is infected by any viral conditions or any viral diseases, bacteria, or they are not injected properly, they are not vaccinated properly, that's why this PEM can be occur. 10 is poor medical facilities. Mainly in the slum areas and also in the very outskirts and very rural areas, the medical facilities are not that much good. So the child can be the sufferer of the PEM. And the 11th is ignorance. As the mother know that her child is retarded growth, but the child have the growth retardation, but she is not aware of it, then the ignorance can be the main cause of this problem. Okay, and the last, and there are many others problem like the improper hygiene, sanitation, as the religion customs, and mainly the increase of morbidity rates, and also the causes of this PEM. So in the next class we will discuss the more about it. For today that is enough, and thank you.